Mr. President, my name is James Lee, and I'm a nurse at Overton Brooks VA Medical Center in Shreveport, Louisiana. I think the goal of expanding health care coverage to include the 30 million uninsured Americans is one we can all work toward. Coverage must come first. There is too much at stake in the lives of individual patients. What keeps this debate over reform so intense is the individual stories we all have about people caught in the injustice of needing health care and not being able to gain access to it. I myself have experienced this struggle 15 years ago when my wife and I were uninsured. We had been married several years and were ready to become parents, so we were in the process of researching healthcare options for us. We met with insurance representatives from different agencies and left discouraged every time. I was self-employed and bringing in about $400 a week. We qualified for Medicaid, but both of us balked at the idea of being recipients of any kind of welfare, and so we opted against the available government insurance. In the midst of our research, my wife woke up one morning nauseous and exhausted and decided to mail off the application for insurance without any further delay. Although we were enrolled in the insurance program ASAP, of course, by then we had a pre-existing condition which they refused to cover. So we dropped coverage and paid for our prenatal care out of pocket. When it was time to give birth to our first child, my wife needed an episiotomy that caused her to lose a lot of blood. I don't know how much, but she was pale and gray and hard to keep conscious. We could never have afforded a blood transfusion. Now that I'm a registered nurse, I know she needed blood. What if I had lost my wife over a lack of insurance? As it was, it took us years to pay the hospital bill. The Kaiser Family Foundation says it is mainly low-income working families that are uninsured. The expansion of Medicaid to include more people, including dependents up to the age of 26, and everyone below 133% of the poverty level will encourage more people to take advantage of available government insurance, as a greater number of people would qualify. CNN reports that 22% of people making less than $36,000 a year do not have health coverage. The inclusion of people with pre-existing conditions that have been priced out of healthcare will also increase the number of insured Americans. As a nurse at the VA Medical Center, as I previously stated, I have the privilege of caring for veterans that are receiving insurance from the government they've served. They are not rushed out of the hospital before they are ready. They are not afraid to seek medical care for their conditions, and they are confident they are receiving competent care. The government insurance that is available for low-income families as well as veterans and federal employees appears, from my perspective, to bring confidence and security to the patients who have it. I have seen firsthand the benefits of government insurance, and I recommend our nation work towards universal coverage for everyone. I appreciate how Senator Dodd said that you can't deal with the other issues of health care until you deal with coverage. The efforts we make toward making health care available for everyone in America will enable us to address and amend the other issues impacting health care. Thank you.